Chief Health Officer.
And good morning. So as the Premier said, it's certainly really positive that we're starting to see the effects of strong contact tracing and the effect of lockdown come to bear on this outbreak. We've got 9 cases who've had their entire infectious period not in the community. That's a really strong sign. And of the 4 cases who have had infectious time in the community, the movements of 3 of those have been very substantially limited because of the effect of the lockdown. Can't say yet whether we're ahead of this thing, but I do know that our contact tracers, our health team, public health units are wrapping their arms around it, and it's going in the right direction. But this really significant outbreak that we've had, even compared to the last one, started with 2 infectious cases who were just out infectious for 1 day. So that tells you why we need to be across each and every infectious case in the outbreak. To lift restrictions now on another day of new cases who've had some time in the community and double figures of cases before we've fully wrapped ourselves around this outbreak, while we're still seeing curveballs of cases potentially not yet linked, we'll put all of the sacrifices of Victorians at risk and make it all for naught. We do not want that to happen. So it's too early today to lift restrictions. We've seen significant and standalone outbreaks in regional areas in Phillip Island, in Bacchus Marsh, Barwon Heads, and as far away as Mildura. Around a third of all our primary close contacts are in regional Victoria, right across regional Victoria. This outbreak has touched the whole state, and that was in a way that the Delta and Kappa outbreaks didn't do back in May and June. Much of that is due to the super spreading events early on in this outbreak that took place in the MCC Members Reserve for the Geelong-Carlton game, something that brings Victorians from far and wide and back home far and wide across Victoria. And those impacts are rippling across the state. So for those reasons, each of us is really going to have to double down to keep our community safe for the next week. I'm so grateful for everyone's contribution. I'm grateful for everyone who's forgoing that contact with family, with loved ones, with friends, with events for this time, especially as Eid al-Adha is underway, and significant cultural coming together can't happen in the way that we'd all like it to. So thank you for doing that online, for picking up the phone instead. It's a significant sacrifice, but a really important one that's going to protect all of us from the potential further transmission and serious illness. There have been multiple deaths now with this Delta variant, including 5 in Sydney's outbreak. And we could have real and awful consequences if transmission were to continue to occur in Melbourne. So those family gatherings can't happen for any of us across the state right now. That's my message to everyone. But my absolutely enormous gratitude for those sacrifices that we're making. I'll hand over to Jerome. Thank you.
Thank you, Brett, and good morning.
Thanks, Premier. Certainly, it goes without saying that this extension is reviewed each and every day. So there'll be new information that we have through the course of today, through tomorrow, that gets weighed in each and every time. But for the last few days, the real indications are what do I expect? What does the public health team expect the effect of lockdown will be for the newly emergent cases that we'll continue to get? We're just now seeing that people will have a very limited number of contacts by virtue of the lockdown. There's assumptions that are based on robust data about the proportion of people who might be in essential work and therefore will definitely have contacts. Our likelihood of finding close contacts for a person who's infectious in the community, that's close to 100%, obviously, for household contacts, for those casual contacts that might be in shopping centres, outdoor areas, who've attended events prior to lockdown or are just out and about within the limits of the lockdown, what the likelihood of finding each and every person who might be exposed. And therefore, you can work through some modelling about how long you expect those generations of transmission to effectively be quashed over time, and 7 days is the judgment about having a sufficient level of confidence. We won't get to 100%. We won't say that after 7 days there is absolutely no risk of someone being out in the community infectious, but there is a high level of confidence that we'll be on top of it. Equally, that might come earlier, or again, there might be something from left field, a super spreading event, someone not complying, someone not discovered in the community, or indeed another incursion into Victoria that hasn't been detected thus far.
Brett, given that the majority of these cases have been in isolation already, how much has this new mystery case played into the extension of this lockdown?
Oh no, it's one of all of those factors. It's not the be all and end all by any means. If there hadn't been that mystery case today, if you like, my advice still would have been 7 days. It is a concern not to yet have it linked, simply because there might be undetected cases who've transmitted to this individual. It might be that through further interviews and re-interviews, we'll find that exposure site, that link. That said, this individual wasn't in isolation through the entire infectious period, so there's a risk of transmission to the workplace and to others.
Where do you expect us to be after 7 days, Brett?
Look, they're essentially about outdoor work, exclusive outdoor work, things like landscaping, solar panel installation, work on properties that are unoccupied, for example. But the full details will come to you.
Where do you expect us to be?
About the ability of contact tracers to get on top of this outbreak play into the decision to extend the lockdown?
I don't have any concerns about the contact tracing capability or capacity. There's no question that when you get to 18,000 primary and secondary close contacts, that you've got a huge number of people who need to be doing the right thing, to be in that strict quarantine, not to be leaving the house for any reason whatsoever. But the contact tracing capability to identify those individuals, to direct them to quarantine, no question that that's working perfectly.
What does your data show, or what are you predicting Melbourne's case numbers will look like after these 7 days? What are you expecting based on the modelling that you just referred to?
Expecting that we'll be absolutely in single figures, that there's a reasonable chance that we'll have no new individuals who are out in the community during their infectious period. There's a probability that sits within. There's always uncertainty around that.
So do we have to be at 0 cases or no new cases that have been infectious in the community to come out of the lockdown in 7 days?
Yeah, it's really about the cases that we identify having not been out in the community for any period of time. Again, going back to how this started, how it started in Sydney, how it's evolved in Adelaide, a person who's out in the community for any time with this Delta variant could transmit to one person, could transmit to no people, but could transmit to 20 people. And so you have to be sure that you've got the response around that risk.
If we're really lucky to the end of this lockdown and there's a case that pops up, someone who has been out infectious in the community, perhaps having done the wrong thing, can we expect a lockdown extension?
Not necessarily. So, I think I spoke to this a bit yesterday. If we've got a person who says, look, I have just been tested, I was out in the community for this reason as an essential worker, but they've only been to their workplace. We know the shopping centre that they might have gone to, they wore a mask the whole time. We know the timing around it. We're responding within 48 hours of that detection. All of those things might mean that you don't have to be concerned about further transmission that you can't get on top of. If someone says, I've been tested but I've been symptomatic for the last 7 days, that's an entirely different story. I don't expect that to happen, and in all of the close to 100 cases that we've identified thus far, people are overwhelmingly doing the right thing. People are identifying the exposure sites that they've been to, and increasingly we're seeing that they're out in the community for a shorter and shorter period. I think yesterday I spoke to the 1.7, 1.8 days, infectious days in the community. It was down to 1.5 based on yesterday's calculations. I reckon it's under 1 for today, given that the great majority haven't been out in the community at all.
If we're really lucky and there's no cases or they're all linked and it's, single digits, could you consider ending the lockdown earlier?
Look, I'm sure we'll come back to you over the course of the next week where you'll ask that question every single day, and we'll be reviewing that on a day-by-day basis. Of course we do that, and all of those positive directions are a positive reflection for us about how long it might need to go for.
And if it looks like regional Victoria is all clear, would you consider ending that earlier for them?
The same. There's a day-by-day review. It is fair to say detections in sewage in Phillip Island, cases in Mildura, primary close contacts across the state. There's a lot to play out here yet, but of course it's under review every day.
Red zone permits are on block now for Sydney. In terms of permits that will still be issued for essential workers and people having to travel between the states, are you satisfied with the conditions of them, or will you look at tightening them on things like getting a test before, or tightening the conditions so they can't go out and get takeaway food and stuff?
Look, they are very tight conditions. We don't want to stymie them so that they really can't do the work that the exemption is in place for, but they are very strict conditions currently. Yes, we'll review them. We've reviewed them just in the last few days. We need to look at that continuously, but I'm happy with the settings as they are currently.
And then is the block on red zones all red zones, and how does this link in with South Australia, which has just gone into a lockdown today?
Yeah, look, the directions are framed that it is something that applies to all red zones. The concern is obviously about Greater Sydney in particular, but it would apply to any red zones as they get declared.
And what's your thoughts on the situation in South Australia? Will that...
Look, it's probably too early to know definitively. There's new information this morning that I need to get across, but you know, we'll look at that through the course of today.
Do you know how many Victorians are still in New South Wales?
Sorry, Bridget?
Do you know any idea of how many Victorians are still in New South Wales? Are we talking hundreds? Or...
No, look, it's really hard to know. Obviously, if they're not applying for a permit, we don't know that they're there. We've had hundreds of new permit applications on a daily basis, but it was thousands. Initially, we've had over 10,000 permit applications altogether. There may well be hundreds, if not thousands, remaining. Some of those will want to see it out and are happy that they're remaining in Greater Sydney. Obviously, they've been given weeks and weeks of notice about the opportunity to return to Victoria, so I imagine there isn't a great urgency for them. Circumstances change for people. That's what the exemptions process is for.
Have you been more concerned about that case in Queensland? Did anything prompt this decision? Is there anyone coming over the border who's been doing the wrong thing? An increase in red zone permits, something that sparked that decision now? No,
it's the whole picture. With respect to the Queensland case, I don't think that materially changes our view either. My understanding is that there's an individual who is a primary close contact who's travelled to Queensland. They've tested negative initially. They've subsequently tested positive. They were messaged from us as soon as we were aware of them as a primary close contact, and that's prompted the testing. Whether or not they transmit to anyone else, that's all in Queensland Health hands. I've had some communication with the Chief Health Officer this morning on that, and obviously we have our fingers crossed for them that there's no further transmission from that case.
Of all the exposure sites and kind of spreading events we've had so far, which one or ones are of the biggest concern for you? Which ones is there a possibility that we might have kind of adjacent outbreaks happening?
It's very hard to say. Obviously, we are encouraged when we get 80-90% of test results back from those exposure sites, and they're all negative, where we see that transmission hasn't occurred with all the people that we've tested. But the MCG transmission was a very big one. As Jerome spoke to, Ms Frankie restaurant was clearly a site where transmission occurred very readily, but the ability to trace people is an absolute positive, and the QR code system and ability to reach people very quickly changes the game in that respect. So we've still got exposure sites out there. People still need to check every day. There can be new information that will come through today if there are positive cases from any of those that really changes the view again. All we can say is please check those exposure sites, please get tested, please quarantine as a Tier 1 contact for any of those sites.
And what are your thoughts on how big sporting events are going to be able to proceed after this? Are we any chance of getting up to 75-85% capacity again?
I hope we are. Of course, we have to reflect on the transmissions that have occurred at AAMI and MCG with the Delta variant, and what the Delta variant means for how we manage that going forward. It's really not about the total number. You know, the tens of thousands of people attending an event is significant. But when we open up again, we'll have hundreds of thousands of people visiting each other's homes, out in the community, going to restaurants, going to various events. So the multiplying effect there is also significant. What we need to be sure of is that the risk mitigations that we have in place across the state for all of those events and interactions are as strong as they possibly can be. And so for sporting events, that'll be about, compartmentalising people within zones very strongly to make sure that we can contact trace a reasonable and manageable number within those zones, that they have their individual toilets and food stalls for those zones, and so on and so forth. The ingress and egress out of gates, also an issue that we have to reflect on. Staggering times, potentially having more open points of entry and exit will be important. What else we can do, we'll keep looking at it, but I don't know that means that we can't get to big crowds, but we can't guarantee anything yet.
There were concerning pictures this morning. Gate 7 outside the MCG, which you said was a big point of concern. How do you police that? How do you ensure that people aren't crowding around that gate?
Look, I think there are things that you can look at in terms of crowd control. There will be some of those event managers who know more about that than I ever will. But, there's an opportunity, for example, to have QR code symbols available for people to tap on or to get that scanning read across a much broader geographical area, so that they're not going to the gate to have that QR code read with hundreds or thousands of other people. A little bit like we're checking in at the airport for domestic flights, that we've got those stands that we can go to individually rather than being in a big queue. So those are some of the principles I think that can be applied for entry into stadia. It is difficult to manage. Obviously, you can't have people coming in over 3 or 4 hours before a game. They'll need to have an efficient mode of entry.
Brett, given we've seen cases and exposure sites from the night we went into lockdown, would you consider in the future maybe bringing the lockdown in at 6 p.m. instead of midnight to prevent this happening?
Look, we do it as early as we possibly can. I think it's just as important to message to people that even if they've got stuff scheduled on the day where public health directions are going to come in at midnight, if they can possibly cancel them, that they should do so. When we've come to the view that we need new public health directions that are going to bring in a circuit breaker or a lockdown or whatever restrictions, I think we can and should message that really we want people to be limiting their movement from that moment onwards as soon as we come to that determination. If we can bring it in earlier, and there's lots of complexity in getting all of that information together and making sure that the directions are right and tight and appropriate, we'll do so, but it doesn't happen in a couple of hours.
Just another question for Premier, if possible.
Yeah, of course.